is Ian Evans, who's a leading member of Unite's National Industrial Sector Committee for Health. Ian's also a local health worker and he's a dedicated NHS campaigner. And as I mentioned to you before, he's a prolific tweeter. He's a very amusing tweeter, so if you're on Twitter, I do recommend that you follow him and have a look at his tweets. He tweets as Brighton Beaker. Who knows what that could be a reference to?
Muppets.
But we're not suggesting that Ian's a Muppet now, are we? And those who do follow him will see that he often changes, he doesn't change his username, obviously he's always at Brighton Beaker, but he often chooses a name to reflect a local campaigner. He was Ian Pleb Evans for quite a while. I can't quite remember what he is at the moment, but maybe he'll tell us in a minute. Anyway, here's Ian Evans.
Thank you very much. I should have changed it back to Ian Evans, I've gone sensible. But prior to that, I was Bingo Evans. As an NHS employee, I'm going to tell you a little bit about myself and the reason why I ended up in the NHS and why and what I do today. The story, in fact, starts with my mother. She died 20 years ago, almost to the day. She died of a long and progressive illness. She died of an illness which was largely unknown at the time. Widely known now, it's called lupus, or SLE. It left her in many, many different states, and she went through a long period of time of mental anguish. She had several attempts to kill herself as well, and again, it was difficult for her, and again, it was difficult for those who cared for her because they didn't understand the illness that she was going through. The problem with lupus, it actually mimics other illnesses. But there again, doesn't actually show the classic symptoms, so again, it doesn't actually come up on normal tests. Now, my motivation was when my mother died was to actually understand this a little bit more. I started working with Lupus UK, and again, they actually had limited information. So I met a colleague who was the same, well, somebody had become a colleague in the hospital, and again, I spent time working with him in regards to the illness, and so much so I ended up joining the NHS as a lab support worker. Now, this is the beautiful thing about the NHS. It looked at me, understood my issues and my concerns, and they actually turned that around and sort of adapted it. They gave me the opportunity to get some training, education. I went on to do several courses, including a degree. I now specialise in biochemistry and immunology. Immunology is one of the main areas for detecting and identifying SLE. So in some respects, I haven't been able to do anything for my mum. I've been able to do things for other people, and again, help them to identify their illness, help them to manage it, and help them to move on. Now, as I say, the treatment my mother received over effectively a 40-year period was significant, caring, and always heartfelt. And again, it wasn't about, I'm going to work, I want to go home. It's going to work, what can I do, and how can I help? And again, this is so true for everybody who works in the NHS. And again, we have a belief, a feeling, and an understanding. Now, unfortunately, the situation is the government changes on a regular basis. And when the government changes, the attitude towards NHS and any other public sector employee changes with it. And again, the issues around that one, it's just so poor. We're demonised, we're marginalised. And again, we're made to feel that we're some sort of second-class person, but we're not. We're told that we're gold diggers, our pensions are fantastic. These things are not true. We work hard, we care, and we will continue to do so. But the thing is, it is different now, and again, we are made to feel, well, we're made to feel worse, and it's a shame. I know most people here today, and most people outside will feel exactly the same way as we do, and they appreciate we're doing a good job. However, there's other people out there who believe in the Tory government, that they believe that the Conservatives is the only way forward, and again, if they vote for them, everything's going to change, it's going to get worse. We've heard about the attacks on Lewisham, we've heard about Clause 118 and now Clause 119 as well, and again, the implication that's going to have upon us. Now, I've been quite lucky, as I say, to get the training, and again, I campaign and I work, oddly enough, with the government, or the civil service rather than actually the politicians, into actually ensuring other people get trained and other people have the opportunity and develop themselves and actually work for the NHS. The problem is, will they carry on working for the NHS? We've seen, bit by bit, little pieces of the NHS being sold off and being moved onto the private sector. And again, it's done by stealth. It is literally piece by piece. We know the local campaigns here have been about audiology. I mean, there's lots of people here who have actually been involved in trying to help audiology. We also see other effects now on the bank workers, which I'm sure other colleagues will mention a little bit later. And again, it is quite remarkable. And now we get told about our pay. 1%, but only for some of you. I went to my staff room and I said, right, half of you there, half of you there. You're getting a pay rise, you're not. And they go, why is that? I said, that's how the government have decided this. This is how it's been dictated. For somebody who's on top of their pay band, they're going to get a 1% pay rise. Again, low the cost of living. Anybody else who may be getting a progression payment point, don't. So again, you're being marginalised and you're being denied. I've just received an email about 20 minutes ago from a colleague in Kent Community. They're actually going to say, if people don't actually meet the criteria, they're not even going to get the 1% pay rise. And they're actually what they're also going to do is take away all their pay protection as well. So what they're trying to look at now is actually putting people's pay down rather than up. And again, it's a continued attack. As you're probably aware, the NHS has been set up to fail. And it's quite extraordinary, the length of attacks which is happening to us now. And you have to consider that everything's going to change within European rules and regulation. There's something called a transatlantic trade and investment partnership. Now, for certain areas, it may be a good thing, but in regards to health, this will be the absolute death of the NHS. Any service they get sold into the private sector, say like audiology to Specsavers and that, will not be returned to the NHS, purely because the Americans would have owned it by now. They have the bigger lawyers, they have the bigger money, and you can't win. A good example of these things is the National Lottery. That was a debacle when they tried to pass up the Virgin. Virgin got their revenge in some respects by keeping hold of the trains. These are supposed to be going back out to tender, back out to bidder, so down to the highest bid or the best bid or the most personal. These will be lost because the lawyers in America will grab hold of this and it will maintain the situation. And you will just see, slowly but surely, all these will disappear and you will never get them back. It'll be too late. It'll be an NHS by badge, and again you'll see an ambulance in London, it's got NHS on it, it's not owned by the NHS, it's owned by a private firm. And again, lots of little places like this now will be taken over the badges. We've learnt lessons. I mean, again, Lewisham was a wonderful example of how to do it. 2 weeks ago, I was in Nuneaton, which is near Coventry, and the George Eliot Hospital. Now, this is a hospital, again, it's going to be put under special measures, and again, there's going to do a Hitchinbrook situation. There's going to push it out to Circle, Virgin. Everybody else who wants to buy it, anybody but the NHS. People organised, they campaigned, they won. A very important story here, they won. And as I say, like George Eliot is staying with the NHS. And again, it's just such a fundamental lesson to learn. And again, we must look at these things in the importance of what can and can't happen. And I'm going to just say a couple more words. One about mobilisation and engagement. One of the things about Lewisham, everybody got together, everybody got off their arses, everybody got out in the streets, and they made a difference. And again, this is what we have to do across the country. We have to get up, we have to mobilise, and we have to work together. All of us at the same time with the same voice. It's so important. I think probably always end on a phrase. The NHS is safe in my hands. It's safe in mine, not the bastard who said it. Thank you very much.
Thank you, Ian.